Hello, so for my report today, this will focus in nursing priorities for patient with acute abdominal pain. So my case is a 21-year-old female who presented to the ED with right lower abdominal pain. So her presenting symptoms were right lower abdominal pain, constipation, nausea, and vomiting. So let's just revisit her background and history first, okay? So for the patient privacy and confidentiality, let's just refer to her as patient Dina. So Dina has had right lower abdominal pain from 3 months ago, wherein her full blood count was checked and ultrasound was done. So the finding that time was that she has an approximately 2 centimeter ovarian cyst on her right side. And then Dina presented to GP clinic a week ago and complained of right lower abdominal pain. So the ultrasound was requested and it was done, and it showed that she has enlarged ovaries. So she was given pain medication that time. However, 6 days later, she presented to ED and stated that her right lower abdominal pain worsened. So in ED, so of course, patient history was taken, full blood count was done, and it shows that her white blood cells were normal. So she was given pain medications and she was discharged. She was also recommended for a follow-up to her GP. However, a day later, that's when she represented herself to ED with not just abdominal pain, but with constipation, nausea, and vomiting. So when she was first assessed in ED, but was transferred to the medical assessment unit while waiting for more examination and laboratory tests. So I have done a primary survey on her, and she is alert and orientated, GCS 15 upon arrival to the unit or to the ward. So her vital signs were also taken. She is slightly tachycardic with 102 beats per minute and slightly tachypneic at 23 resp rate per minute. She is afebrile though. So her heart rate and respiratory rate might indicate that she is in pain. And because she's been complaining of pain, I have also done a pain assessment and I have used the numerical pain scale. So Dina stated that her pain is 10 out of 10 and even compared it to her previous labor pains. So we know that the abdomen has 4 quadrants. So each quadrant has specific organ parts of gastrointestinal system. So for the right lower abdomen, which is in here, we can find the appendix, ascending colon, and parts of female reproductive organs. So there are possible causes of abdominal pain. They can range from less serious cause like indigestion, gas, constipation, muscle spasm, or strain, to a more serious causes like appendicitis, kidney stones, inflammatory bowel disease, irritable bowel syndrome, etc. So, but there are also gender-specific potential cause of pain. So for female, for Dina, it can also be ectopic pregnancy from menstrual pain, endometriosis, or even pelvic inflammatory disease. So individual signs and symptoms are of clinical value to suspect a possible appendicitis, but history and physical examination are of importance too. So to diagnose the cause, the doctor would review the patient's symptoms, medical history, do physical examination, and consider laboratory test results too. So for Dina's past medical history, she has had mitral valve prolapse, hepatitis A as a child, has had PCOS, endometriosis, paratubal cyst, and ovarian cyst. And she also has cesarean section a year ago. For her family medical history, on her mom's side, they had hypertension, breast cancer, and ovarian cancer, and on her dad's side, there's a history of asthma, COPD, and mental health problems. So according to Dina, she's a non-smoker and she's non-alcoholic. She also stated that she lived a sedentary lifestyle and that she has a good social support with family and friends. So because she's been complaining of abdominal pain, we've also done abdominal assessment. So doing abdominal assessment can give diagnostic clues regarding most gastrointestinal and genitourinary pathologies that may also give insight regarding abnormalities of other organ system. So aside from taking patients' history, physical examination is also very important to narrow down the source of acute abdominal pain. So I have done an inspection, so I could see her previous surgical C-section scar on her pelvic area. But there's no visible broken skin or lesion that I have noted. There's also no bruising or discoloration, and her abdomen is not distended. So for escalation, I have used the stethoscope. I could hear some bowel sounds, but it is hypoactive. And so the medical doctor came. He has the one who did the percussion and palpitations. So he had found that there is muscle guarding and rebound tenderness on the area, which is consistent with possible appendicitis. So based on Dina's presenting symptoms and physical examination, the possible cause of her abdominal pain might be appendicitis. So these are the signs and symptoms of appendicitis. So she has the pain, she has the nausea, vomiting, and constipation. So here are other physical examination that a medical officer or a doctor can do to confirm appendicitis. So now that we have suspected that Dina has appendicitis, we still need to do laboratory studies because she has had extensive reproductive health problems in the past that we need to rule out. So we've done again a full blood count to check her white blood cell and CRP levels. We've also done a urine test to rule out pregnancy. She's also underwent pelvic and transvaginal ultrasound to clear her reproductive organs, and at the end, she's underwent CT scan to confirm the appendicitis diagnosis. So for nursing intervention, I have categorized it with the three. So the first is preoperative and postoperative pain assessment and management. The second is the monitoring of her vital observations. And the third is the post-surgical wound care. So preoperative, so I have addressed her primary complaint, which is the pain, nausea, and vomiting. So she was written medications on her med chart, so I've just administered it. So that was IV metoclopramide for her nausea and vomiting, and IV paracetamol and subcut morphine for her pain. For preoperative nursing intervention, so we'll be monitoring her pain level, assess it, and give her pain medications based on her pain level. So we have done, or we have administered PO or IV paracetamol, which she can have 4 times a day. There's also a PRN endone or a subcut morphine, whichever suits her based on her nausea. So if she could take the oral endone, then that was fine. And we've also administered a prophylactic antibiotic, which was peptaz. So I have also made sure that she is nil by mouth because she needed to undergo a surgery. And because she is nil by mouth, we don't want her to be dehydrated. So we have administered the IV fluids based on the fluid order, and we've been also monitoring her bowel sounds. So for post-surgical nursing intervention, to be honest, I have not looked after Dina post-op because she was transferred to a surgical ward after her surgery. But here are some of the nursing interventions I would personally do or prioritize for her post-op. So I will monitor for signs of infection, so post-operative vital signs, and inspection of the surgical incision site to check for any redness or swelling that might indicate infection. So I would also do pain assessment, and based on the on her pain will be the pain management. So if she needed PRN pain relief on top of her regular analgesic, so she'll also have the IV antibiotics and IV fluids while her bowel hasn't returned yet, while her bowel function hasn't returned yet. So but I will personally encourage early ambulation to stimulate peristalsis and passing of Platus. So, in conclusion, I believe that it is very important to deliver a personalized patient-centered care. Each patient are different, so their needs can also vary. But for as long as I have done a proper primary survey, which includes the physical assessment, timely reporting or escalation to the doctor when needed, and appropriate ward-based management as per the doctor's order, and of course the documentation. So I believe that the patient can receive a timely and effective intervention to prevent further deterioration. Thank you.